Hi, my name is Jermaine Page and I'm a nursing student at Antoniana College. And I want to talk to you today about the legal and ethical uses of restraints. First of all, I want to define restrain, which is to prevent someone or something from doing something, or to control them, or to keep within limits. You have three main types of restraints. You have your physical, your chemical, and your environmental restraints. With your physical restraints, they go on your waist, your arms, and your legs. And they're used to control movement, to keep the client from moving. The chemical restraints are used. They're a mixture of Benadryl, Hydol, and Ativan, which they call a B52. And you also have your environmental restraints, which is moving a client to a certain area and keeping them locked behind a closed door, or just changing their surroundings. You also have you have emergency restraints, which is your ECR, emergency chemical restraint, which is where you use your Benadryl, your Hydol, and your Ativan, your B52. And you also have your EPR, your emergency physical restraints, which is simply you putting restraints on their waist, their arms, and their legs. A physician must authorize the use of restraints. They must have a limited time of use. With physical restraints, they must be removed and the skin must be assessed. They must be removed frequently. You want to, before you apply restraints, you want to use the least restrictive measures first. You want to, okay, and after restraints have been applied, the physician must see the client within an hour after applying the restraints. The restraints, after keeping the restraints on for 24 hours, the physician must reevaluate the situation to see if the client needs to keep the restraints on, or if they can be removed. Some of the common problems with restraints are loss of muscle tone, pressure sores, incontinence, and loss of mobility. Some of your problems with chemical restraints is loss of cognition, hallucinations, and loss of ADLs. Some of your problems with environmental restraints are reduced social contact, decreased desire to eat, and withdrawal from your surroundings. Some of your common ethical considerations for using restraints are: is it important to the client? Is the safety of the patient or the staff or other clients at risk? What's best for the patient? What does the patient want? Are there other alternatives that can be used? Also, other ethical considerations are, the client has the right to refuse any kind of restraints. They have what is called autonomy which they can make any decisions on what happens to them. They can make that call. Okay, some of the legal considerations. The healthcare staff are able to act in the best interest of the client. When they run into a situation where the client could be in severe pain, or the situation may cause the client to die, they have a common law principle of necessity, which if they take a client in and they fail to do that, they could be charged for negligence. Restraints may only be used when clinically justified. A written procedure must be posted on how to use the restraints. And you must have a person that has been trained to apply the restraints and also to remove the restraints. When using physical restraints, you must make sure that they're not too tight. You must make sure that the limb is in a comfortable position. Normally, when they apply restraints, they put a bandage or a sleeve under the restraint to keep from causing damage or injury to the area. You also must remember, do not apply a restraint over a client's chest. You could restrict their breathing. You always, when you put on restraints, you want to restrain both sides. Never restrain one arm or one leg. Okay, medication can be forced by IM injection if a client is to be restrained by chemical restraints. You want to make sure that you offer bathroom trips every 1 to 2 hours. You want to make sure that you frequently feed the client, and you want to also make sure that they have fluids. Frequently give them fluids. You always want to make sure that you document. Good documentation, because if you don't document, you didn't do it. You want to frequently access the site, the polls, to make sure that the client is okay. And whenever a client is taken off of restraints, they must be interviewed. You also, any client under any type of restraint must have one-on-one supervision. Now, what I want to do, I want to show you a picture of a restraint. This is a picture of a restraint, a physical restraint. Right here we have the leg restraints, we have the arm restraints, and we have the waist restraint. That concludes my presentation on legal and ethical uses of restraints. Thank you.